next guest has spent more than 30 years in public health. James Blumenstock is Senior Vice President for Pandemic Response and Recovery of the Association of State and Territorial Health Officials, which is the organization that represents more than 100,000 public health professionals across the country. James, thank you for being with us. And I just want to get your reaction when you hear this CDC study saying that there have been almost 300,000 excess deaths from coronavirus. Or really two-thirds of those being attributed to COVID-19. What's your reaction to that?
Well, hi, Brianna. The data speak for themselves. Clearly, we are seeing a serious uptick in cases across the country right now. And as you talk about the demographics and the populations that are being represented in the data that you've just shared, I think we could attribute the increase in cases really to two main factors. First is the change of seasons. With the fall coming and colder weather, more people are going to be recreating and socializing indoors, which really increases the risk of exposure. And the second point, which is a harsh reality, but we have to recognize it, is the fact that we as a society are dealing with pandemic fatigue. It's real, just as the threat is. We have to recognize it's been a long, hard 7 to 8 months for everyone, and sometimes we let our guard down, especially as we try to return to some degree of ordinary life and activities. But still, we all must be strong and not fall victim to a false sense of security, even when we're in familiar or otherwise safe environments. We all have our own personal or social bubble that we feel comfortable in. But in these times, and with the data that you just shared, clearly that is not sufficient protection for us to rely upon if we're going to get through this together in a safer way.
Let's talk about the vaccine now, because you actually say that states won't have the money to distribute the vaccine properly. Why is that?
Well, the states and territories and local health departments are really working 24/7 to build out their plans and develop a state of readiness should and when an acceptable vaccine become available. The level of effort and the money needed to do planning, is minor compared to the amount of resources that will be needed to launch this national historic complex vaccination campaign that could commence as soon as the next several months. It is hugely labor and technology intensive, and the nation's public health system just does not have available resources in its coffers to support that level of effort to ensure that the vaccine is administered as safely, efficiently, and effectively and equitably as possible.
And yeah, this is something it's labor intensive, right? This idea of distribution. It's not a simple task. What more do they need going forward?
Well, our association and others estimate that the resources needed for the duration of this campaign is estimated to be at $8.4 billion. We certainly respectfully disagree with Secretary Azar's assessment that sufficient funding is available. But we do not believe so, and nor does the CDC. And the point to be made here is that this is going to be, a tremendous level of effort. We don't want to basically erode all other essential public health services for this campaign. We need to augment this effort while still providing all the other essential services that the communities need and deserve. The U.S. government has invested in billions of dollars in vaccine research, development, and production. That same level of commitment and effort should be applied to the nation's public health system that's responsible for the last tactical mile, as we say, where the vaccine is going to be allocated, distributed, and administered in the communities throughout this country.
Yeah, it's huge, right? The vaccine isn't the answer. Vaccination is the answer, and states are a huge part of this. James Blumenstock, thank you so much. Thanks for being with us.
Thank you. My pleasure. Thanks for the opportunity.